Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well, saving lives. Here we are going to talk about another question of cardiology. A 54-year-old female presents with the inability to lie down flat on her bed at night. On examination, she has widespread bibasilar crepitations on auscultation and an irregular radial pulse. Her past medical history is significant for an anterolateral myocardial infarction a year ago. Auscultation of the heart reveals a 206 grade pansystolic murmur at the cardiac apex and its important pansystolic murmur at the cardiac apex. She has no other medical problems. She does not drink alcohol or smoke. What is the single most likely cardiac defect that this patient has? A. Tricuspid regurgitation. B. Mitral regurgitation. C. Mitral stenosis. D. Aortic stenosis. And E. Aortic regurgitation. We can hear pansystolic murmur in tricuspid regurgitation, atrial septal defect, and mitral regurgitation, but the site of the murmur is important. While the murmur is in the cardiac apex, we can say that it's mitral regurgitation. Okay, here we are going to explain more about mitral regurgitation. Okay, it's clear from the stem that this patient has mitral regurgitation. There are two types of mitral regurgitation: primary or degenerative mitral regurgitation and secondary or functional mitral regurgitation. From the patient's past medical history, we can see that she has had a relatively recent myocardial infarction, and this is one of the common cause of mitral regurgitation. The most important complications or a myocardial infarction that we need to recognize in this stem is mitral valve dysfunction and an atrial arrhythmia. Okay, valvular heart disease. Here we are going to explain a little more about valvular heart disease. We have listed the common heart valve disorders here. There are certain keywords that, if you see in the exam, would help point you towards a specific heart valve disorder. Okay, aortic stenosis. Aortic valve stenosis is the most common valvular heart disease, hence the most commonly asked heart valve question. The two most common pathogenesis are age-related degenerative sclerocalcific change to the valve, and most common cause usually in elderly patients, and congenital bicuspid aortic valve, which is common in younger patients with aortic stenosis. The signs of aortic stenosis is ejection systolic murmur, best heard at the second intercostal space at the right sternal border, which radiates to carotid arteries. As we can see in this diagram, a normal aortic valve while it's open and closed, and aortic valve stenosis while it's open and closed. When we have an stenotic aortic valve, while the contraction of the left ventricle, when the ventricle is pushing the blood through the aortic valve, when it's stenosed, the blood through the aortic valve with pressure, and it produces an ejection systolic murmur, which we can hear it at the second intercostal space at the right sternal border, and this is pathognomic for aortic valve stenosis. Okay, mitral regurgitation. Mitral regurgitation, which is also known as mitral insufficiency, is the second most common heart valve disorder, and the signs of mitral regurgitation is soft S1 and S2 pansystolic murmur at the fifth intercostal space in the left mid-clavicular line, which radiates to the axilla. Okay, note, pansystolic murmurs are found in the mitral and tricuspid regurgitation and ventricular septal defects, as we mentioned above. Here in this diagram we have a normal mitral valve, while the left ventricle contraction, the mitral valve must be completely closed and the blood must enter from the aortic valve. But in mitral valve regurgitation, while the left ventricle contracts, the mitral valve don't close completely, and some of the blood re-enter the left atrium instead of entering aortic valve, and this produces an pansystolic murmur, which we can hear it at 5th intercostal space in the left mid-clavicular line, which is pathognomic for mitral regurgitation murmur. Okay, mitral valve prolapse. Mitral valve prolapse is common in heritable connective tissue disorders like Marfan syndrome, Ehlers-Danlos syndrome, and osteogenesis imperfecta. Most patients are asymptomatic. The classical case would be a slim young female with low blood pressure. Okay, when we see a slim young female with low blood pressure and with mitral valve prolapse, we must think about Marfan's syndrome, Ehlers-Danlos syndrome, and osteogenesis imperfecta. Mitral valve prolapse is a risk factor for mitral regurgitation. Signs of mitral valve prolapse: mid-systolic click, best heard at 5th intercostal space in the left mid-clavicular line, followed by a mid or late systolic murmur with findings accentuated in the standing position. And it is important when the murmur is accentuated in the standing position, we can think about mitral valve prolapse. Mitral stenosis, rheumatic heart disease, is the commonest cause of mitral stenosis worldwide. Signs of mitral stenosis is mid-diastolic murmur with an opening click. The click represents the mitral valve opening, best hit at the 5th intercostal space in the left mid-clavicular line. And aortic regurgitation. Aortic regurgitation causes include rheumatic heart disease, infective endocarditis, Marfan syndrome, amongst others. Signs, okay, early diastolic murmur, best heard at left sternal edge. Pulmonary stenosis. Signs of pulmonary stenosis. Pulmonary stenosis is an ejection systolic murmur, best heard our pulmonary area and radiates to the left shoulder or infraclavicular region. As we can see here in diagram of pulmonary valve, we can see in this we can see here a normal pulmonary valve with 3 valve leaflets and normal pulmonary valve, and also we can see also narrowed valve opening with thickened leaflets. Why the contraction of left ventricle, the right ventricle, the blood enters pulmonary valve, but when the pulmonary valve is thickened and the leaflets are thickened and the opening is narrowed, we can hear ejection systolic murmur, which is in pulmonary area and radiates to the left shoulder or infraclavicular region. Okay, tricuspid regurgitation. Signs of tricuspid regurgitation is a pansystolic murmur, which is best heard our tricuspid region. As we can see in this diagram, it's showing a tricuspid valve, while the contraction of right ventricle, the blood enters the pulmonary valve. But when we have any dysfunction in tricuspid valve, the tricuspid valve is not closed completely, and some of the blood re-enters the right atrium instead of entering pulmonary artery, and it produces a pansystolic murmur, which we can hear our tricuspid region. As we can see in this diagram, the blood is returning back to the right atrium while contraction of the right ventricle, and the tricuspid valve, while the contraction of right ventricle must be completely closed and the blood must enter the pulmonary valve. Okay, here was a short explanation about cardiac murmur. In this diagram, it's showing the point of different murmur in which side we can hear it. And this is showing aortic area, which is the second intercostal space from the right side of the patient, which we can hear systolic murmur or aortic stenosis, aortic valve sclerosis, and also any aortic valve abnormality. Okay, in the right side of patients, we can, in second intercostal space, we can hear the pulmonary valve murmurs. Okay, tricuspid valve, we can see here under in fifth intercostal space or beneath the sternal bones. Sternal bone, we can hear tricuspid valve murmurs, and in the apex of the heart, we can hear mitral valve murmurs. This was a short explanation about valve abnormalities which we can hear in different patients. Thank you for your attention.